Welcome, everyone. It's a pleasure to have you at our very first episode of our Connect with HSPC webcast. So my name is Melanie McGregor, and I'm the chair of the Halton Suicide Prevention Coalition. So our coalition, we are a group of organizations and community members from throughout Halton, so Burlington, Oakville, Milton, and Halton Hills. And our focus is working together to provide leadership and advocacy and education around suicide awareness, suicide prevention, suicide intervention, and suicide postvention. So we're really excited to be launching this webcast as just another way for our community to think about suicide, to hear from different perspectives as well on the topic, and maybe think about some things that they hadn't thought about before, and really learn how we all as a community can collaborate and work together in order to create suicide safer communities. So the name of our webcast is Connect with HSPC, and Connect stands for Connecting Our Network for Necessary Educational and Courageous Talk. So we'll certainly have lots to talk about as we have more and more episodes and things unfold. So we have on the call today some other members of the Halton Suicide Prevention Coalition as well. And very shortly, we'll be introducing our special guest and having a nice chat with her. So if I can introduce our folks on the coalition. So first of all, we have Melissa Grates, who is the vice chair of the coalition, and she is from Halton Region, the health department. Next, we have Dara Eisner-Clancy, who is the executive director of Distress Center Halton. And we also have Natalie Pierre, who's a wonderful individual, great community advocate throughout Halton. So I'm going to start by turning it over to Dara, who is going to introduce our special guest.
Thank you, Melanie. It is my pleasure to introduce Stephanie MacKendrick to our first panel for HSPC. Stephanie is the CEO of Crisis Services Canada, which operates the Canada Suicide Prevention Service, our national suicide prevention helpline that connects Canada's distress centers into a single national network. Stephanie recently led CSC into a game-changing suicide prevention partnership with the Centre for Addiction and Mental Health and the Canadian Mental Health Association. Stephanie's impressive career has spanned journalism, corporate communication, not-for-profit leadership, and most recently, the author of In Good Hands, a book to encourage young women to consider running for elected office. Stephanie has been twice awarded WXN's Top 100 Most Powerful Women in Canada, and she is an inductee in Canada's Telecom Hall of Fame for promoting women's advancement. And a fun fact, when she was only 11, she campaigned for the right for girls to wear trousers to school so she could play ice hockey during recess. And she still plays hockey today. So welcome, Stephanie.
Well, thank you very much. Delighted to be here.
Thank you so much for joining us. So I will start off the questions, and it's a bit like speed networking, about 2 minutes a question, and we'll get started with, tell us a little bit about Crisis Services Canada.
Yes, Crisis Services Canada launched in 2017, and it was really a project and initiative that was many, many years in the making. It started with the Crisis CDLN, the Crisis Distress Line Network in Canada. And at the time, there were a lot of gaps in the coverage. There was no national service, and so people had to rely on finding local services or regional services. So there was a real gap there. Mm-hmm. So the vision was to create a national service, one number that people could call, one text short code, so that people had really much easier access to the services that they need when they needed them. So it was, we created a network of distress lines across the country on a technology platform that takes calls or texts from service users or help seekers and connects them to the nearest available responder in our network. And so that way we're able to provide 24/7 coverage by voice. And we offer text service from 4 p.m. to midnight.
Okay. Well, thank you. And what do you see as 2 or 3 keys for preventing suicide and creating suicide safer communities?
I think you know, there's a couple of key things. I think reducing the stigma of asking for help. And I think that interestingly, COVID has accelerated that because people realize, I think more people realize, it's more broadly recognized that it's smart to reach out for help. It's a good thing. It doesn't show weakness, it shows strength. So I think that is part of it. But suicide's a very multifaceted problem, and it needs addressing from many, many angles. Crisis lines are part of the spectrum, and that's local crisis lines plus the Canada Suicide Prevention Service. So I think it's creating the right services. And I think the other thing is prioritizing mental health to the same degree that we prioritize physical health. I think it's fair to say that mental health has taken a back seat. It's kind of optional, kind of, an extra, something that you might need, but it's not really necessary. And I think that understanding has to be addressed. And then the last thing I would say is we really have to look at some of the priority populations and ensure that we're providing equal access and equal service to all the populations in Canada.
Oh, thank you very much, Stephanie. Something to think about.
So over to me, Stephanie, for the next couple of questions. So how do I know if someone is thinking about suicide? What should I do? And how would I know if someone's just joking?
Okay, well, I think the first principle, there's a couple of things. Two key pieces of advice are, don't be afraid to ask, and don't try to solve it alone. So I think people sometimes worry that if I ask, how are you doing? If I start probing, I could trigger something. And I think that is a bit of a myth. I think the most important thing is to have a conversation with people. And again, because of COVID-19, we've been, I think, getting better and more conscious about reaching out and asking people, touching base with them, how are you doing? And I think the thing is to invite the conversation and to pick up on the cues. And I think, people, when you're having those kinds of conversations, you want to listen very closely and listen for how people are doing. And I think that it's really important to not be afraid to say, are you thinking about suicide? It won't trigger someone to take action. But I think it's the elephant in the room. And I think the more open it is, I think the more that you can help. We find that on our crisis line, around 70% of our help seekers are having what we call suicidal ideation. They're thinking about it. And so I think that really getting to the question is important. And then don't try to solve it alone. There are resources that you can reach out to. There's our service, the Canada Suicide Prevention Service. We have a 1-800 number. We have a texting code. There are community services. Halton is an example of that. So I think it's that empathetic listening, asking the questions, and really being supportive, not judging, and enlisting the kinds of services. And sometimes it may be professional services, or it may be another trusted friend or a family member, but really trying to listen and just checking in with people, and then following that empathetic listening.
Okay, and my next question. So has there been an increase in suicide-related calls during the pandemic?
We are seeing an increase in calls to our line. We don't have a view once people call, so we don't know what ultimately is the result, or what they experience after they call us. But we are seeing increased traffic, and we think it's I think the cumulative effects of the COVID crisis, there was an immediate spike, I think, when the crisis was identified, and the distress lines, the front lines, really took that first huge leap in calls. People were wondering what's going on. It wasn't necessarily suicide related, but I think as things progress, as career, family, trying to juggle daycare, trying to manage finances, people, maybe at work or only partly at work or not at work. So there are a lot of different factors and stressors at work right now. So as they accumulate, we are seeing a rise in the calls that we're getting, and we've increased the capacity, and I think that we're able to, I think, de-escalate, and I think that's really important. Getting back to the last question about what do you do, calling for help, whether it's our line, the local line like Halton, or other resources are really important at this stage. People need support, and it's the more people reach out, I think the more that we can address the issues and provide a solution if you want, at least to support people. I think the other issue is there is a concern, generally speaking, about mental health, because of the pandemic, but also because of some of the things that are happening in a more broad sense in society. So I think that there's also, what we are looking at is there needs to be training, specialized training for response when we have to call emergency services. So our first line of defense or of service is to provide de-escalation. So finding out what the issue is, trying to create a safety plan. We'll arrange a follow-up call if needed. So that is our first line. And then if we're unable to be assured that the person who's calling is safe, if we feel that they're at imminent risk of harm, or if in fact we believe that there is a suicide in progress, we call in emergency services. And there's been a lot of attention given to a lot of the shortcomings of that service. So, our view is that there's a lot more training that needs to be done, that there has to be mental health training, specialized in de-escalation, specialized in how to deal with situations that are very acute, that it really is life or death, and moments matter, and how you respond really matters. I think that there's probably room for specialized, I know there are teams of mental health professionals who can respond in some jurisdictions, in some areas. We need to do more of that, and we need to provide special training for both the emergency services as well as some of these other specialized teams.
Great, thanks, Stephanie. And you actually touched a little bit on my next question with what you were just speaking about regarding the need for increased training. What else do you think needs to be done at the community, provincial, and national level to address the anticipated spike in mental health needs and suicide as a result of the pandemic?
Yeah, I think that there really has to be a focus on mental health. And I think there also has to be two things: coordination of different levels of service between provincial, national, local, and there has to be a dedication of funding to support the services. And I think that there is increasing recognition that that's needed, but it's not at the level it needs to be. So we need to really create focus and pull together. As you know, the health delivery system is a provincial mandate. The health infrastructure is a federal mandate, and then locally there are a number of their community groups. There are mental health supports. There are hospitals, clinics, and right now we don't feel that the coordination is at the level it needs to be, and it needs to be given resources. That if it's important, it needs to be supported. And I think there's a lot of research out there that shows that investment in mental health at the front end, supporting people before they get to a point where they're really, desperate or considering harm, it pays off so much if we can de-escalate early. So it's a really good investment for our country to make at every level. And then if we can invest the resources that we need, it's really important to coordinate them, because that's where we will have the efficiency. And I think that distress lines like Halton like our other member sites, need to have sustained funding because they are an integral part of the system that supports people. And so I think that we've identified that as a really important aspect, is getting some systematic and sustained support for distress centers. And then I think it's also making sure that the money is there as we go through COVID especially, and as we anticipate that there could be a substantial rise in the need for support. It's a really good investment to make in mental health, so that people are supported before things develop, before it gets really serious. So that is one of the key things that we really think has to happen.
Okay, excellent. Thank you so much. Those were some great points. Switching gears a little bit to talk a little bit about the services that Crisis Services Canada provides. The crisis support is available by text as well as phone. Can you tell us how the text option works? And is it as effective as speaking to someone over the phone? And then also, who do you see really using this text option?
Great questions. So we have the phone and text options, and what we find is that for us, it's really important to provide service in the modality that people are most comfortable. Some people want to talk to people and they need to have that connection. For other people, they're maybe not as comfortable, and connecting by keyboard, by text is easier. And so what we find is that most of our service is, I would say, more are calling in, but text is preferred, interestingly, by, we have more women than men using text, and it's definitely skews toward a younger demographic in terms of their preference. I think if it's your preferred mode, I don't think that it makes a difference in the effectiveness of the service. I think it's people want to be comfortable however they are comfortable, as opposed to how we might suggest that they should reach out to us. So the phone voice service is available 24 hours a day, 7 days a week, 365 days a year. And we have, our number is 1-833-456-4566. Text is available from 4 until midnight. And that's a short code, which is 45645. So those are available. We provide service in English and French on the voice service. Text service is in English at this point, but our plan is to expand the hours of text and to offer it in both official languages as soon as possible.
That's great. You're talking about all these things that we really focus on as well: collaboration and training, and that just opening up the conversation and trying to get what is going to be the most meaningful resource. How can someone seek help in the most the most comfortable way for them? So I know we've talked a little bit about what can we do to recognize maybe when someone might be thinking about suicide, but what would be messages that you would give maybe to someone who is thinking about suicide? What would you like them to know or to remember?
I think the most important thing is that it's okay not to be okay. There's a lot going on. There's a lot in people's lives, and we're in no position to judge, what any other person is going through at any given time. So concerns are valid. And I think that is at the heart, the most important thing. And to not be afraid to reach out for help, whether that's a trusted friend, a family member, a local service, a national service. I think the most important thing is to really make sure that you reach out, and there's no stigma. There's no it's a strength to be able to say, I'm really struggling, and I need some help. I need to talk to someone. And I think that if that could happen, I think that would be a huge step if everyone felt that way.
Yeah, couldn't agree more. And I think it comes back to a little of what you were saying about kind of putting mental health and mental health needs on par with our physical health, which I feel like we're making some steps towards that, but we still definitely have a long way to go. And I know you and Crisis Services Canada, you're a big part of that. So I'm really, kind of interested and fascinated by your job role. So I want to know, like, what are some things that you love about your job?
I love this job. It is a very demanding job. There's a lot at stake. So it demands one's full attention, but we're here to help solve a problem and to provide support. We're under no illusions that we can eradicate any kind of emotional pain or difficulty, struggles. But we really believe that if we can create a really robust suicide prevention service that we're well on our way to providing, that there's a safety net for people. And it's so important. And, for me, I've spent the, greater part of my career in not-for-profit leadership, and that is really addressing a mission. And this mission is so vitally important. And I can tell you the thing that's most enjoyable about my job is I work with an absolutely spectacular team. We have a group that is so dedicated to achieving our mission. We're a very small, I like to say small but mighty team. And so it's, to have, to be able to work in an area that's so meaningful. You get up every day and solve problems, and you feel like you really are making that difference. And, each of us does a small part. It's our team, it's our service, it's your service, it's services across the country. But each one of us can and does make a difference. So, as we move forward and as we, recognize the issues, as we push forward with a strategy, as we provide these services, we know you get up every day and you're doing something really important.
Absolutely. That's great to know. Again, I love how you've touched on again that everyone has a role to play in our community. So that's wonderful. So anything else before we wrap up? Anything else you'd like us to know about you, about Crisis Services Canada, about anything else that you'd like to share?
Well, I just think the only thing is to say, we're delighted to be working with Halton. It's a really important collaboration for us and with our other members. And we're there, we are there to help people, and we're there for people to reach out to. And it's not just people who themselves are, having concerns about suicide. It's if there are suicide-related concerns about a friend or a family member or a coworker, we can reach out and help. So just encouraging everyone to think about what the resources are, and just those very simple things of reaching out, listening, asking questions, being there. We'll be here for people. And I think everyone can to some extent be there for the people that they know and love.
Excellent. And we will be putting up some resource numbers and things like this at the end of the webcast so people know where to reach out for support. But yeah, definitely some excellent reminders there. So this has been great. I mean, time has just flown. You've covered so many great points. And I mean, thank you so much for being with us for our very first episode of our webcast. I think it's a great reminder about how people and organizations can work together in communities. And, I'm sure, hopefully, anyway, that's something that you're seeing across the country is more collaboration and everyone realizing, the difference that we can make and the things that we can do to help. So thank you so much for everything that you do. And thanks for joining us today. And as well, thanks to Dara and Melissa and Natalie for being part of the interview as well. So to our viewers, stay tuned. We'll definitely have more webcast episodes coming up with a range of different special guests, so you can stay tuned for those. You can also keep an eye on our website, which is haltonspc.ca, and also follow us on Twitter. So we are also at Halton SP. Sorry, I said SPA. It's haltonspc.ca is the website, and our Twitter is haltonspc. So we'll be promoting our webcast and our other services and organizations, so definitely stay tuned. So thanks for joining us, and we hope to see you again soon.